Now, let's talk about how you can come to the realization that you're mineral deficient. Are there telltale signs, number one, that you'd be deficient in minerals? And are there any tests you'd recommend for people to find out for sure if they are deficient?
Well, for a lot of athletes, they'll start getting like muscle cramps or
Mm-hmm.
spasms, and that's usually a deficiency of either salt or magnesium, potentially even calcium or potassium. So there can be some signs that are induced. But like my paper when we published on subclinical mineral deficiencies, the majority are not seen. They're not visible, and they may not even have any symptoms. Now, yes, can you have headaches or migraines from magnesium deficiency? Of course. Can you have photophobia where you literally don't tolerate light because of magnesium deficiency? Absolutely. So there are sometimes signs, even eyelid movements and rapid movements like that, muscle twitches. But the tests are also needed for the majority of people because, again, they don't present as frank deficiencies. For example, vitamin C deficiency, that doesn't really appear until you're near death, where you're having bleeding gums and things like that. And you don't want to even be close to that point. So there are, probably the easiest test is actually blood test. You just have to know what end to look at. So you're typically never going to go below normal if you're deficient, but you will go to the lower end of the threshold. So if you're anyone and you get a magnesium blood test and you're on the lower end of normal, that's highly indicative of actual deficiency. And so we need to sort of start thinking of blood as, yes, this is a great biomarker because the body tries to keep it in perfect range. But if it shifts just a little bit lower than normal, than the mid range, that is a great indication that you're actually probably deficient.
Yeah, no, I mean, we see it so much in some of the analysis we take, blood analysis. We also have some, I don't know if you ever heard of Oligo scan. It's a scanning using a special spectrometry basically into the tissue to kind of get, a bounce back and get a normal reading of connective tissue almost in certain areas to see. And it kind of corresponds to a lot of what you see in the blood, which is nice. And it gives patients a little bit of understanding quickly of where they are and if they are deficient. And unfortunately, so many are. They come in, they think they're leading a healthy lifestyle, eating this way, and end up, being deficient.